This morning, we have the latest wrinkle for you in plastic surgery. It's actually an alternative to the traditional facelift, getting a lot of attention these days. Plastic surgeon Dr. Jon Turk is here with us this morning to tell you about the Acculift. Great to have you with us.
Thank you.
So this is kind of an alternative. As I'm reading about it, it almost sounds like it's liposuction for your face, which sounds really lovely at 8:30 in the morning. What is it exactly?
Well, Erica, so many patients are coming in asking for less, actually. Less surgery, less anesthesia, less recovery time, and they want to spend less money. And so clearly the trend is towards less invasive procedures, and that's why we're so excited about the Acculift. I like to think of the Acculift as the bridge between facial fillers and facelifts.
Because we hear a lot about fillers as people age, because you do lose, some of that fat in your face.
Right.
So it gives you that gaunt look.
Correct.
But this is actually taking fat out.
Right.
So how is this in between the...
Sure. So early signs of aging that we see, especially in patients in that kind of 45 to 55 range, the fat will accumulate in the lower face, as opposed to in youth where we have those nice full cheeks. And so what we see is the face turning more into a pear shape as opposed to that apple complexion. So what we want to do is use the laser, the Acculift laser, to sculpt and tighten the skin of the lower face while not losing any volume in the upper face.
Okay, so that's why you say it's sort of in between the fillers and the
Yes.
facelift. So how does this actually work? You say it's a laser, you go in under the skin, we're looking at pictures right now, and you actually melt that fat that would accumulate sort of, I guess, in your, your jowls, really.
Yes. So this is the actual laser fiber, and you can see it's quite small.
It's like a little pin, like not even a safety pin, it's
Yes.
smaller.
And this is inserted under the skin, and the fat is very gently melted very precisely and then removed.
Okay, I want to look at some. I know you have some before and after pictures that you brought with us as we talk about some of the other minutiae here and how long this lasts. The first one you have lips. Now it's been really popular in the last years for people to get collagen, which doesn't always look all that natural. So here's the before picture of one lady who had her lips done. And then as we look at the after, talk to us about the differences here.
Okay, so this is one of the most common problems we see that patients come into the office for. And you can see around the mouth these deep grooves, or what they call smile lines. And this is a patient that normally would get filler and come in every few months to have this done. And a facelift would be totally ineffective here. So actually what you see in the after is this dramatic softening of those lines around the mouth. And we expect this to last several years.
Several years, wow.
Yes, yes.
Okay, so our next picture is of a gentleman who came in, his neck, he felt like needed a little bit of work. Let's take a look at, so there's the before picture. He doesn't look very old.
No, fat accumulation in the neck and under the chin can happen really at any age. It can be hereditary factors or from early aging. But again, with the Acculift, you can get a very nice contouring of the lower face and the neck, and this is a minimally invasive procedure. And I just want to say that these photos were sent by Dr. David Holcomb, who's a colleague of mine in Sarasota, Florida.
And you can really can see the difference right there. Our last one, we actually are going to do the live reveal in studio. Ronnie's with us this morning as we take a look before. She was having some stuff done right here in the chin area like we talked about.
That's right.
So this is her before picture. And then as we get her seated, we can take a look at the after. And Ronnie, I'll ask you, as we look at your results, is this exactly what you were going for?
Exactly. I had been going for fillers, and Dr. Turk suggested the Acculift.
And do you feel like it looks more natural?
Oh, 100%. It achieved the results I was looking for.
You mentioned that in the first procedure we saw with the lips, that could last a few years. For someone like Ronnie, when we're talking about the chin, does that last a few years as well?
Yes, absolutely.
All of these do?
Sure.
Now the big question, of course, is how much does this cost?
Sure. Well, this, as I mentioned, or may have mentioned, is about a third of the cost of a regular facelift. So depending on where you are in the country and how many areas you actually do, it'll be somewhere between $2,000 and $6,000 for the procedure.
And just real quickly, how readily available is it because it is such a new procedure?
Actually, there's only a few physicians in the entire country that have this machine. But it is out there, and we have been doing it for about the last 18 months.
It's wild. It's really interesting. And that little needle, I can't get over how small
That's
it is. All right. Well, keep an eye out for it. Dr. Jon Turk, Ronnie, thanks for being with us this morning. Thank you.